I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Morning, Dr. Lebo Gyno. Second case of the day. Got this 31-year-old young man from Los Angeles, California. Got a lot of people from LA, from California. And he researched and he chose the best. He chose Lebo. All he needs is bilateral gyno gland removal. No lipo. He weighs, what do you weigh, 150?
Yeah.
Yeah, 150. To do lipo on him would be, cruel. If you look, if you have somebody with the serratus muscles there, doesn't need lipo. All he's got is these little puff titties right there. On this side and on this side. That side's a tad bigger, I think we talked about. Hole there. So if you grab it, you don't grab it this way. You grab it like you mean it. Grab under it. So you can almost feel, it feels like a scallop, basically, in there. Like a good old, sea scallop, big old scallop. And on this side, a tad more. You can almost flip this thing. It's flat. It goes, see, I can almost, I wish you can feel this, guys. It's like, there you go. It's almost, he knows what I'm talking about. So under local anesthesia, stealth incision, where the water meets the beach from about the 4 o'clock to the 8 o'clock position, make an incision there and perfectly, precisely, and accurately remove these glands. Once the main gland is out, then I look here, I look here, I look here, I look here, make sure that there's no remnants left over, and I remove all the glands. Maybe I leave just a tad underneath the nipple, just a little support, a millimeter, 2 millimeters, just for support. But I do stand by my work. God forbid if these should come back, he just comes back to me and we do it. But I never really had to do that ever. He wants me to start on this side first, which I always start on this side. He said, savor the worst side for when you're all warmed up. I said, absolutely. I always start on the right and I always end on the left. But we'll savor that one for a second. When he gets this out, we're going to biopsy him, of course. He wants to touch him. He wants to feel him. He wants to smell him. He wants to just grab him and throw him against the wall. And he will do that. And we'll be done. He can go get lunch. He can go get a sandwich. It'll be perfect. No post-anesthesia, nauseous vomiting or whatever. Local anesthesia, bilateral gyno gland removal. Let's go. Midline. That's the median. That's the median. And this is the sucker. Right there. And that's the sucker.
Once again, I am Hans. And I am Franz, and we are here to pop your just like that.
Okay. Little incision where the water meets the beach.
Got it.
He doesn't have much fat, so these glands are gonna kind of like pop out.
Yeah.
Like a little meatball.
That is the most exciting thing, is when you like invert the nipple and you just see this thing come pop.
Yeah. Like, oh, flip the nip.
Exactly.
There.
So with these glands, like you said, obviously, like mine are relatively loose. Do some of them attach to?
Attached, like this young man I did this morning. His right side was huge and very inflamed.
Okay.
Very attached.
But are they supposed to like attach to the muscle around it, or that?
It should be pretty easily separated.
Okay.
It's like removing, skin of a chicken.
Yes.
Breast. you can get in there, you just pull it off.
Yeah.
You know what I mean? You know, you get your finger in there, and you can get the chicken, the breast meat away from the skin.
Yeah.
By just getting in that correct plane. Or in a turkey, like when you bake a turkey for Thanksgiving, you put all kinds of herbs and lemon and parsley stuff underneath it, and it's the same thing. You can get in there, butter. So yours is I can tell already that there's no inflammation here.
Okay, got it.
On this young man earlier, who was 16, especially the one side was still probably actively growing, so there was a lot more inflammation and irritation and not scar tissue, I would say, but just more inflamed.
Yeah.
So it made it more adherent and sticky.
Okay.
Yours are pretty much just living in a symbiotic relationship there.
But it's also natural, like sometimes these glands, because I know the one on the left-hand side, like why do they,
go bigger?
Not go bigger, but like sometimes you feel like, oh, there's something going on in there. Like you feel a little bit of pain or something.
It just because it's bigger and maybe more inflamed. We'll see. We'll see how easy that one is compared to this one.
You okay, my friend?
Yeah.
All right.
Because you could literally like sometimes feel you're like, okay, this thing is alive. There's something going on in there.
It's alive. Abby normal. What brain did you get? Abby something. Abby normal?
Abby normal, maybe?
You put an abnormal brain into my monster? That's young Frankenstein.
Yeah.
All right, so I'm getting around it. So I'm underneath it already.
Okay.
You all good, my friend?
Mm-hmm.
I'm gonna ask you that about 1 million times, okay?
I'm more relaxed now than I am when I'm sleeping.
Oh, nice. That's what we do, brother.
I have this weird sensation where in like times of panic I end up being less stressed.
You're doing great, man.
Nice. Getting there. There we go. Side one. Look.
No way.
Wait.
Okay.
Wait.
Remember that racehorse analogy?
Yeah.
Normal. Lift up a little bit there. Good. Just like that. Yeah, this one's not inflamed. I can tell. It's soft.
Oh, okay.
It just might be a little bit bigger, but we'll know in a few minutes when I get the sucker
I
out.
know for sure, like when I started feeling the activity happening, it was on the left side that it started. So that's probably also why it ended up being bigger, because it had that like advantage where it's like I've had, you know.
It started earlier.
Exactly, yeah.
Got it.
Had more time to grow. So like what causes a teenager to develop?
Same thing.
Same thing.
Genetics, hormonal, environmental.
Everything's going great, man.
Okay, cool. It's funny, that nipple actually had surgery before because I had like a very prominent Montgomery gland that I wanted removed. Yeah. And then what ended up happening was my left nipple ended up being the dry nipple because it basically I removed the sweat gland from it. And then and it's that's actually the less sensitive nipple, and now the right nipple is sensitive and the left nipple is, and the right nipple is like nice and soft and hydrated, and the right nipple is always dry because the sweat gland was removed.
How you doing, my friend?
Good.
stop what I'm doing and just teach people.
Just teach. You're gonna have students like me, man. It'll drive me crazy.
All right, guys, so here, what we're doing, this is almost out. We'll compare the two sides. Mr. D here says the left side's bigger.
How you doing, Mr. D?
Good.
All right.
Gonna get a New York strip steak out of that left side.
Yeah, more like a chicken parmesan. maybe a veal marsala.
Yeah,
Oh, man.
half a chicken.
Half a chicken.
Beautiful. Marsala is nice.
I don't like mushrooms. I don't like. Though I take mushrooms, I eat mushrooms. Okay, so here is the. Dr. Lebo Gyno, finished up, 31-year-old young man from LA, Los Angeles, California, who comes to me for my expertise in gynecomastia surgery. We did bilateral gynecomastia gland removal, no need for liposuction. These are the glands that we got out. The smaller one was the right side, the larger one, as he told me pre-operatively, my left side's bigger. I go, yep, you are right. But the art of this, and a great surgeon, is look at how pristine this is. Look how perfectly round each of these are. They're not beat up, they're not chopped up, they're not in pieces. This is perfect surgery done right, when it's out in one piece and perfect. And this is how you can tell the whole gland was removed, because look how perfect those are. My results are perfect, and they'll never return. We contemplated about a drain or not a drain. He actually preferred a drain because he does not want any problems with seroma or needle aspiration underneath the nipple. And I said, well, the only way to do that is put in a drain, but the way I do it, I hide the drain inside the armpit so nobody sees it. The drain stays in about a week. Unfortunately, he's going to travel back to California in a week, but we'll FaceTime and we'll pull them out. They're just held in by one little nylon stitch, and it's easily removed. And it'll tell us when these are out, when they're ready to come out, when the volume is under 20 cc's per 24 hours. All stealth incisions, all self-absorbing stitches, except for the ones surrounding the drain, and he will look amazing and great. And again, it was done comfortably, safely, and perfectly under local anesthesia. So if you have gynecomastia, you're from California, you're from Chicago, you're from Colorado, or you're from Kathmandu, you call me Dr. Lebo Gyno, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. And this is what you'll expect: perfection.